Hi, I'm Donna Schaibley. I'm a state representative from Indiana, and I want to thank you for having me here today. I've worked with Gloria and many of the members of the Employers Forum in my time at the Indiana State House. I've been very concerned about the high cost of health care since I've been at the General Assembly, and I have authored several pieces of healthcare legislation, including price transparency legislation this session that has been amended into some of the bills that we're going to talk about today. The RAND 2.0 study that the Employers Forum did kind of brought to light the importance and the need that Indiana had to address the high cost of health care in Indiana. And I and my colleagues agreed on that. And we had a great number of bills this session that was related to health care, price transparency, and just healthcare in general. We had 19 related healthcare bills introduced at the beginning of the session, and out of those, 13 actually passed. And today I'm going to focus on two: the House Enrolled Act 1004, which was by Representative Ben Smaltz, and Senate Enrolled Act 5, which was authored by Senator Ed Charbonneau. House Enrolled Act 1004 had multiple parts. I'm going to talk about two of them today. One part is the good faith estimate, and the other is the surprise billing part. But this is the good faith estimate section. And it says that practitioners, providers, and insurers for non-emergency ordered or scheduled medical service, if an individual requests the price of an ordered service from a provider, practitioner, or insurer, the individual must be given a comprehensive good faith estimate of the price that will be charged for the episode of care. The estimate must be comprehensive, including all services, medications, supplies, equipment, fees, and material items associated with the care provided. And if insured, the estimate must reflect the negotiated rate based on the individual's health plan. An insurer, if they ask an insurer, they must give an estimate that includes consideration of deductibles and copays. These estimates must be given within 5 business days of the request and are valid for 30 days. They're non-binding and must be given in writing, email, or electronic app. And it is effective as of July 1, 2020, so it is effective now. Second, I'm going to talk about, and this was another section of the 1004, and it addressed out-of-network charges or surprise billing. And at first it says a patient is not responsible for charges above the network rate. If a covered individual goes to an in-network healthcare facility and is treated by an out-of-network practitioner or provider, the patient is held harmless for the costs that go above in-network levels for these services. It does have a section on informed consent, and it says an out-of-network practitioner at an in-network facility may not reimburse more than what is allowed under the individual's network plan unless the individual signs a statement 5 days prior to service, which clearly states the patient agrees to be charged more than the allowed rate under the individual's plan and the specific amount. And that was to allow, if someone had a particular physician or that they wanted to use, and even though they're an out-of-network physician, they were willing to pay the additional charges. So this would allow for that. If the covered individual has not agreed to pay for the out-of-network prices, the out-of-network practitioner must include in any bill to the individual a statement that the individual is not responsible to compensate the practitioner for more than the allowed rate of the covered individual's network plan. And this does not cover emergency services, including emergency transport, and it's effective July 1, 2020. So it's effective now. Another part of the bill that dealt with out-of-network charges was to provide more, we thought would provide more transparency, is practitioners, hospitals, and ambulatory outpatient surgery centers must provide individuals a good faith estimate that's non-binding of the price that they will be charging 5 days prior to scheduled service. And that is effective July 1, 2021. So that's next year. Another section within Senate Enrolled Act 5 was posting of average negotiated rate. and that's effective March 31st, 2021. And it is for hospitals and ambulatory surgery centers. They must post on their website the weighted average negotiated charge for 70 shoppable services, as well as 30 of the most common services provided by the facility for 5 different payers. And urgent care facilities must post on their website the weighted average negotiated charge for 15 of the most common services they provide for the 5 different payers. And the 5 payers for both of these are commercial insurance, Medicare, self-pay with charitable assistance, and Medicaid. Another part of the Senate Enrolled Act 5 included the language that basically is the start of the setup of an all-payer claims database. And the purpose of an all-payer claims database, or APCD, is to gather data on health claims. And this data must be HIPAA compliant. And once the data is gathered together, the use of the data, we can use that data to inform policy and identify healthcare needs, to compare price and quality between various treatment settings, to provide information to consumers and purchasers of healthcare. And I see this as a forward-facing portal to consumers where you can put in your insurance, what kind of insurance you have, and then you can shop among various providers for the service that you need, and you would be able to get information regarding both price and quality, which I think is very important. And this would improve quality and affordability of healthcare. The bill itself outlines the request for information phase, and that we are in right now. The Department of Insurance has submitted that request for information, and the request for proposal phase, that is due later on, and they gave dates for that. It must be run, the database must be run by a private non-governmental entity. We wanted it not to be connected to the government. We didn't think it would be good to have political, be kind of at the mercy of various political changes. And so we wanted to be independent. And the Department of Insurance will finalize the decision by November 30, 2021. Next, and finally, another part of gag clauses that are of Enrolled Act 5 is gag clauses. And this again is just one of the multiple parts of Senate Enrolled Act 5. It bans gag clauses in provider-insurer contracts. It says a health provider contract, including contracts with pharmacy benefit managers and health facilities, may not prohibit disclosure of healthcare claims data to employers providing that coverage. And it must be HIPAA compliant to HIPAA regulations. And it applies to contracts entered into or renewed after June 30, 2020. And this is basically to provide employers with more information so that they can make more informed decisions when they're planning for their employees' health coverage in the future. I want to thank you for having me here today. I want to thank the Employers Forum for all the great work that they're doing. And I would be happy to, I think we do need to do more work in Indiana, and I hope to be able to do more in the future regarding price transparency and healthcare costs. It is still very important, and I am happy to take any questions.